Welcome, everyone. This session is Asthma. It's not just meds anymore. I'm Deb Hickman, co-chair of the Asthma and Allergy SIG, and our SIG is privileged to be the sponsor of this talk. The Asthma and Allergy SIG was formed in 2009 and has just a little over 100 members. If you care for children with asthma or allergies, please consider joining our group. You will gain the opportunity to network with other like-minded peers and have access for sharing and gaining new skills. Please visit our table at the SIG Showcase following this session. Just a couple announcements before I introduce our speaker. Please remember to turn all electronics devices to silent mode. If you are attending with a young child, please use discretion. We ask that you try not to disrupt another's learning experience. And as I said, please join us for the SIG Showcase from 6 to 7:30 p.m. tonight in Regency 5. We encourage you to visit and learn more about SIGs. Posters on the move are available today in Regency 5 from 7 a.m. to 7:30 p.m. Presenters will be available for questions from 6 p.m. to 7 p.m. Join us Saturday at 6:30 a.m. for a Zumba fundraiser. Sign up now at the registration desk. Now it's my privilege of introducing our next speaker, who is also an Asthma and Allergy SIG member. Gal Higgins is the nurse practitioner for the Asthma Care Clinic in the Center for the Urban Child at St. Christopher's Hospital for Children. She was invited to develop and run the clinic integrated into the primary care clinic. Her multidisciplinary team consists of herself, 2 community health workers, health educators, social work, and the medical legal partnership. They also work with community partners. Previously to the Asthma Care Clinic, she ran an after-hospital asthma clinic sponsored by the Section of Pulmonology. Thank you.
Okay, thank you. Thank you for coming today. I'm glad to see all these people who really care about asthma. So as you can see, asthma, it's not just meds anymore, so we're not talking about any medications at all today. And I've got to figure out how to use this clip. Well, it's on, is it up there? No, okay. So objectives. I'll just let you read through the objectives. Basically, what I hoped to teach you today or help you realize what's out there for asthma is how to develop partnerships within the community, what we can do, as providers of children with asthma. So just a quick overview, just a definition of asthma, which is a chronic lung disorder that is marked by recurring episodes of airway obstruction, as from bronchospasm, manifested by labored breathing, accompanied especially by wheezing and coughing and by a sense of constriction in the chest, and that is triggered by hyperactivity to various stimuli, such as allergens or rapid change in air temperature. I got this out of the Merriam-Webster dictionary. I thought it was the easiest to understand and didn't have all the gobbledygook in it. And I'm not sure if any of you are aware of these statistics. I don't know if anybody's talked about these statistics here yet in the conference, but right now, this past year, about 9% of all children in the United States have asthma. But non-Hispanic Black children have much higher rates, up to 22% across the United States. Hispanic children of Puerto Rican descent also have high rates, up to 14%. Children in poor families are more likely to have asthma than children in families that are well off, middle class. And recent studies have shown that the asthma rate is dropping, but not for the non-Hispanic Black child. They continue to rise. Our costs of asthma, I'm sure you're probably all pretty familiar with these. Medical expenses are upwards of $50 billion a year annually. Loss of productivity for missed school days or work days is upwards of $3.8 billion a year. Children are missing upwards of 11 million school days a year. Parents of children with asthma are missing upwards of 14 million days of work a year. There's been an increase of 50% in Black children with asthma between the years of 2001 and 2009. And the percentage of people with asthma increased by 28% between the years of 2001 and 2011. The big question is why? What can we do to stop this? So I just wanted to start at the very beginning because I found some interesting facts as I was working on this presentation. So asthma was first described by Areteus in 100 AD. So I can't even think how many thousands of years ago that was, but it was a long time ago. And asthma, as we know it today, and as how it's described today, was first written about in 1698 by John Floyer of England. And he had actually written a book at that time called A Treatise of Asthma, and he himself had asthma. He described asthma as laborious respiration with lifting of the shoulders and wheezing. And he actually identified what triggered, or what he thought triggered asthma back then. He identified air, smells, exercise, and passions. His passions back then were emotions that we see a lot of children today. Their asthma is triggered by their emotions. A textbook was written in 1896 that wrote about asthma control by removing offending allergens from the environment. And by 1900, it was well established that asthma could be brought on by exposure to environmental allergens. So we're missing over 116 years that things have been done, but not enough. So, anybody familiar with what asthma medication used to be? Nobody? Okay. Here we go. Back in the early 1900s, they used to prescribe asthma cigarettes. They consisted of anticholinergic belladonna-related alkaloids. They would use the stramonium plant, which is actually the thornapple plant. They would break down the leaves, and they would sell the asthma cigarettes. And they felt it would help to dilate your airways. They had the use of non-anticholinergic bronchodilator stimulations, which came in around 1940, which is your theophylline and aminophylline. Anybody here remember aminophylline drips in the inpatient? Those were the fun days. Use of corticosteroids started in about the late 1940s. Albuterol came into play in about 1960s. And use of specifically targeted asthma treatments, chromones, anti-leukotrienes, and the anti-IgE medications, the biologics, came into play in 2000. So you can see we've come pretty far in a very short time. But imagine, whoop, I'm forgetting to click, but imagine having to prescribe these medications or the nebulizer for your patient back then. And today, we have multiple medications, which I'm sure most of you are familiar with all of them, or most of them. But asthma is still here. So if we have all these medications at our fingertips to prescribe to our children with asthma, why do so many children still have asthma? So I came across this quote by Florence Nightingale. I was trying to find the date that she actually said it. But the connection between health and the dwelling of the population is one of the most important that exists. So this was back in, I think, about 1860s, 1870s, she had said this. So it's been going on. People are aware of the connection between health and environment. It has been going on for a long time, but again, not a lot has been done about it. So where do we go from here? Got a long way to go, but we're going to learn about it today. So I found these 4 pillars of asthma management that were put together by the Washington State Department of Health, and they had put together these 4 pillars based on the guidelines. And they're basically pretty much everything that we're all doing. We have planned visits for asthma management. We make a diagnosis. We assess the severity. We test their lung function if we have spirometry in our office. We assess control at every visit. We schedule follow-up visits. We provide a written asthma action plan. We make sure they get their annual flu vaccine. We have appropriate use of asthma medications, education for a partnership in care, and assessment of environmental triggers. So if we can do all 4 of those in our practice, we pretty much will help get asthma under control. But we really need to go beyond these pillars. We need to look at education for a partnership in care. And when I say a partnership in care, I'm not talking just about the family. I'm talking about the community where your practice is, where your patients reside, the schools where they go to school, the public health department, whether it be the state public health department, the city, the town. Go to the payers, your insurance companies, your Medicaid insurances, your commercial insurances, your private insurances. And last but not least, go to your local, state, and federal officials. At my age, I never thought I was going to become political, but unfortunately I have. So we also need to start looking at assessment of environmental triggers at each and every visit that your child with asthma is coming to. And we have to start at home first. What's going on in the home? Are there environmental triggers in the home? Talk with the family about the neighborhood where they live. Are there environmental triggers in the neighborhood? Are there lots of trees? Is there a dump? Are there abandoned houses? Is there a park? Are they near a highway or a busy road? Go to the school if you can, or if you are fortunate like me and have a community health worker, that you can send them to the school to see what's going on with the school, or talk with a school nurse. Go to the daycare. A lot of parents will tell me that, their child gets sick in daycare. When they come to pick them up, they're wheezing, they're coughing. What's going on in daycare? Or go to the preschool, same issues. Or does the child spend a lot of time at the relative's home? Grandmom, granddad. If mom and dad aren't together, do they split time between the homes? Are there smokers in that home? Are there mice in that home? Are there other triggers in that home? So it's not just dedicated just to the child's home. We have to look at everywhere the child goes. So this is, I'm sure you've heard this new buzzword, population health and social determinants of health, which came out with the Healthy People 2020. So we're really, at my job, we're really focusing on population health now and the social determinants of health. Is everybody familiar with the social determinants of health? Anybody heard of them before? Just a few, okay. So the social determinants of health are the conditions in the environment in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life, outcomes, and risk. So there's the 5 social determinants. We have education, economic stability, neighborhood and built environment, health and healthcare, and social and community context. And these were identified as ways to create social and physical environments that promise good health for all, which is the goal of the Healthy People 2020. So first I'm going to cover health and healthcare. So your healthcare should be based on the NAEPP guidelines, NHLBI, assessment and monitoring of the child, patient education being done at every office visit, medication management, are they on the correct medications? Are they refilling them monthly like they're supposed to? Are they overusing albuterol? Are they using a spacer? And control of environmental factors and other conditions that can worsen the child's asthma. How many of you do environmental histories when the child comes in to see you? Okay, I see just a few hands. I'm hoping by the time you all leave, every single one of you will start doing environmental histories with your patients. Next comes the neighborhood and built environment. So what's so important about this is, and again, it's going to be dependent where you work, where you practice, where your families live, is access to healthy food. Do they have access to grocery stores? The quality of housing. Is there crime and violence in the neighborhood? Environmental conditions of the neighborhood. Are there abandoned houses? Do they live near factories, highways, dumps, or parks? Where I work and practice, we're in a food desert, which means there are no close grocery stores for our families to get to. So they end up usually, getting somebody to take them to the grocery store that's, 10, 15 minutes away by car, or they go to the local corner market to buy food. Next is the environment. Home, like I said before, home assessment is very, very important. It needs to be done at the office, and if possible, if somebody can go out to the home and do a home assessment. Lots of times parents are very embarrassed to say what's going on in their home. We've learned this the hard way, but I find that if I send in an educator to do education when they come in for their visit, because they're not the provider, they're pretty much equal, or the families see them as an equal, they'll start to spill and tell them what's going on in the house. What to look for in terms of your triggers in the home and the environment is going to be dependent on where you live and work, like I said before. You've got urban versus suburban versus rural. And the other important question to ask is, where does the child spend the most time? Are mom or dad working at nighttime, so the child's spending overnight at the daycare or at grandmom's house or aunt's house or uncle's house? All important things to consider. Now, this next slide I'm going to show you actually is an environmental history sheet. You can get it from NEAF, and it's on your reference list. It's a great tool to have for your office. You don't need to, you can sort of make it personalized of what will fit your practice. It also comes in Spanish, but it's a great tool to use when you want to do an environmental history. So the home environment. Has the parent identified any triggers in the home? Are these triggers able to be removed? Can the parents afford to remove these triggers? Is there remediation work that needs to be done? Say, pulling up carpeting, caulking windows. Does a heater need to be fixed? Is there mold in the bathroom, mold in the kitchen, mold from a leaky ceiling? Is the family willing to work with you? And the biggest question is, can the family afford remediation? But there are, depending where you live, there are community organizations that can help pay for remediation. It's just a matter of putting the time in and looking for them. So triggers in the home. I'm sure you're all familiar with these: dust, mold, mildew, furry pets, carpeting. Cleaning supplies is a huge issue where I work. Incense, candles, room air fresheners, cigarette smoke, both inside and outside, and type of heat that's being used in the home. We're finding more patients who have broken furnaces, broken boilers, who are now using propane heaters or electric heaters in their homes, or they're using their stove to heat their house. How many of you ask about what kind of cleaning supplies your family uses in a child with asthma? Nobody? Okay, that's a very important question. About 95% of my patients in North Philadelphia use bleach to clean their house. And you know what bleach does to a child with asthma or an adult with asthma. And just to give you an idea, I had a patient come in. He was 3 years old at the time, had had 7 emergency room visits in 7 months with 7 doses of oral steroids every month. And I started doing some teaching with a grandmother who I knew very well. And she admitted to me that she cleaned the entire house with bleach, down to washing her dishes with bleach. But she also admitted that she washed her grandson's dust mite mattress cover and dust mite pillow cover pretty much weekly with bleach. I got her to stop that. We were able to lower his controller medication. He has not been back in the emergency room since I first started to see him, and he's only had to have 2 courses of oral steroids in a year. So it made a huge difference. So something just as simple as getting a parent to stop cleaning with bleach, Fabuloso, Lysol, Lest Oil, Pine Sol can make a big difference. So our to-do list, and this is our to-do list, is to educate the family. It doesn't have to be a big, huge education at every visit. You want to get, at the first visit, if you have time, try to get the guts of what they need to know about what happens when their child has an asthma attack. See if there's a home visiting program for asthma in your town, city. There's asthma coalitions in every state. You can contact them. They'll be able to tell you if there's any asthma programs, or your public health department. In Philadelphia, we're fortunate that we have 2 that we can refer to. If the family lives in a public housing situation, call them to see what they can do to help remedy the issues in the home. Has any of you ever heard of Healthy Homes? Green and Healthy Homes? Okay. That's another, they're up to about 50 cities now in the United States, and they're growing. It's a program where they will actually go into the homes, do remediation at no cost to the families. And if you're interested, they are out of Baltimore. Just greenandhealthyhomes.org or Green and Healthy Homes Initiative to see if you can get them to come into your city. And work with the family to come up with a plan. It used to be that if you had cats and dogs in the house, it was like, get rid of the cats and dogs. Remember those days? Okay? You don't need to get rid of the cats and dogs anymore. You just need to have a dog-free zone or a cat-free zone for that child to sleep in. But you really want to involve the families and, what can they do? Can they clean up the clutter? If they have a cat because they have mice, well, of course they're going to, keep the cat, that kind of thing. Triggers in the neighborhood. If they're living in a city or even in a town, do they have abandoned housing near them? If you're living in the city with houses close together, lots of times the vermin will travel from one house to the other. Are there rats? If there's been a lot of broken water mains or a lot of, what do you call it, when the roads collapse? Lots of times the rats will come up. Is there trash just being laid around because people aren't caring or, throwing? All of these issues can start to trigger a child's asthma. Are there idling vehicles in the neighborhoods? States now have idling policies, especially for school buses, that they're not allowed to idle at schools for more than 3 minutes because of the diesel fumes. And pollution. Anybody aware of the EPA flag program? No? Okay, the EPA has an awesome flag program. They also have airnow.gov, where you can look on daily, put in your zip code, you can find out what your air quality is, your ozone level and your particulate matter level. Particulate matter level in your air, which is what causes the air pollution. And they'll tell you if it's a green day, which is good, all the way up to a purple day, don't let anybody with any kind of lung disease outdoors. So it sounds like it's a lot to do, but once you start working on it, it gets pretty easy. So what can you do about triggers in the neighborhood? You can contact the city, the town, see what they can do. The EPA has local regions. Find out all you have to do is go to the EPA.gov, put in EPA local region offices, and they will come up with a list of the different regional offices. And they are more than willing to come out and help you, or come together with trying to figure out what you can do for your city or your town or your area where you live. Teach the parents how to manage exposure to pollen. Tell them, make sure they keep their windows closed at nighttime. Pollen can travel 200 miles in a day. The children can go outside and play. Pollen's already started in Pennsylvania. I know it's already down here. We want the kids to go outside and play. Parents know if they go outside and play, they're going to start sneezing, going to start coughing. Tell them we want them outside and play. Give them albuterol before they go outside to play. When they come in for the night and they're done, they're not going back outside, they need to get in the shower and completely rinse off, head to toe, and put on clean jammies or a clean set of clothes. Because what happens is these kids were coming in from outside after playing outside in the afternoon, after dinner, and they're coming in covered with pollen. So what happens? They go to bed covered in pollen, and all they do is cough and sneeze all night long. So it's an easy fix for the parents to do. And also look at the locations of highways near the schools and home. That's another huge trigger. Sometimes you really don't have much control over that, but it's something to be aware of. So economic stability, what we want to look at here. Poverty. How many of you work in areas that are poverty-stricken? Yeah, it's rough when we're working in those areas. Employment, is there a high unemployment rate? Are the families dealing with food insecurity issues? Are they running out of food before the end of the month? Have their food stamps been cut off? Did they lose their ability to get food stamps? Do they actually run out of food? Housing stability. Are they afraid the landlord, if they rent, is going to kick them out if they try to do something to the house? Does the child have insurance? Is another huge thing. Most of my practice is about 95% Medicaid, so we don't have too much of an issue with getting medications for our kids. But then we have families who have private insurance. You know, we think it's a good private insurance, Blue Cross Blue Shield. And then when it comes to getting their medications, they have a horrible prescription plan, and they have to pay $145, $150 for their controller medicine. And the parents don't have that money for out of pocket. So these are all things that we have to take into, when we see a child with asthma. Can the family afford environmental remediation? Like I had said before, there are organizations out there that will help with environmental remediation. And sometimes it may not cost anything at all. Just remove carpeting, keep a pet-free zone. And another big one is the parent or guardian's job at risk. I've had parents come in and tell me that they've actually lost their job because they've missed too many days taking care of their child with asthma because nobody ever told them about the FMLA Act. So we've got a lot on our list here. So if you have access to a social worker, get that social worker involved. Refer them to the local welfare office if they don't have insurance or they're having difficulty with insurance. Look for prescription copay assistance programs. A lot of the pharmacy companies do have those programs. They can get at least 1 month of controller medication free, sometimes up to 12 months. Refer to home visiting programs in your area to have, whether it be a community health worker, a nurse, go out to the house and do an environmental assessment for you. Connect with community programs and educate the parent about the FMLA. When I've had the parents who had lost their jobs because of their child's asthma, no one had ever told them about the Family Medical Leave Act. So it was very, very frustrating for them. So next on the 5 social determinants is education. So is the family being educated by the healthcare provider? Does the family actually understand what happens during an asthma attack? So many of our families, the child starts coughing for 5, 10, 20 minutes, and all of a sudden they're running them to the emergency room. Is the child missing multiple days of school? By missing multiple days of school, these children lots of times get left behind at the end of the school year because they're so far behind in their reading levels, their math levels. Is the parent or guardian of this child, are they illiterate? Do they understand when you give them written paperwork to know what to do? I have a few parents in my practice. It's not that they're going to come out and tell you that they can't read, but it's just something that you just sort of pick up on, and that's when you have to realize, oh wow, we have to do it a different way now. Or is English the second language? If your parent speaks English, fluently, can they read English? Do they understand the English word when it's read? Find out what their native language is, and ask them, would you like materials in English or would you like them in your native language? They're very easy to find on the web. The best place is just to Google Asthma Action Plan in Korean or whatever language you need, and it will come up. There's lots of websites out there. The best ones are from Australia, believe it or not, but they have about 15 different languages. So they are available out there. And the school environment is a huge issue. Our children are spending about 8 hours a day in school, 5 days a week, so that's 40 hours. So if there's issues with the school environment that are triggering that child's asthma, we've got to get into that school and figure out what can we do. So school triggers, vermin, that's one of our biggest issues in Philadelphia. Dust. How many of you have seen, classrooms that are really dusty and cluttered? Nobody? Few? Good. That's a problem. Clutter, cleaning supplies. I'm sure everybody sees their kids come home with a list of what they have to bring in, and some of them will be like, the Clorox wipes or the Lysol wipes. All of those can trigger a child's asthma. There are green cleaning supplies for school. Art supplies can trigger a child's asthma, strong odors. Classroom supplies, again, like the cleaning supplies. A lot of classrooms now are not using chalkboards anymore. They're using the whiteboards. And those whiteboard markers can trigger a child's asthma and send them to the nurse. Classroom temperature. If your child is in a classroom in an old school building, it can be very, very hot, or it can be very, very cold. Extreme temperature changes can trigger their asthma also. These are all, I mean, I know it sounds like I'm sort of overwhelming you with all these things that we need to think about, but we can do it. So what do we do about the school? We need to have an open line of communication with the school nurse. If that school nurse knows that you're available for her, she'll be calling you if the child's having issues. And that's what you want to know. Is the child having issues in school? Are they using their albuterol a lot? Are they being sent home a lot? Get them involved with your plan of care. Make sure they have an asthma action plan at school so they know what to do. Ask to visit the school if possible. Go there, see what the school is like, especially if it's not a school you're familiar with. Is it old? Is it new? Is it well ventilated? Is it hot? Is it cold? We were just at a school recently to do education with parents, and of course no parents showed up, so we educated the kids. I thought I was going to die from the heat, and this was just in one room on the first floor. So I couldn't even imagine what it was like in the other rooms. But that'll give you a good idea of what's going on. Is there an asthma management plan in place for the school? I know a lot of schools don't have school nurses every day. Philadelphia, we have schools who have no school nurses. So we finally have an asthma management plan in place in Philadelphia, but that's something that's really, really important to have for your local school district in case something happens. When the parents come to see you with their child, listen to what they have to say about the school. Do they say that when their child goes to school or when they come home from school, they're always coughing, they're wheezing? Sometimes I'll ask the kids, what happens when you walk into school? Do you have any problems? Oh yeah, 10 minutes as soon as I walk in, I've got the itchy nose, I've got the runny eyes, the itchy eyes. Recently, within the past year or so, went to a program put on by the EPA about schools and what is found in schools. Ventilation is a huge issue. That, you know how they have the vents in the schoolrooms on the, along the windows and whatever? Lots of people pile stuff up on top of there. Remember how when we were in school, we'd be in the classroom in the late afternoon, we'd start getting tired and sleepy? They've been doing measurements when they go out to do environmental assessments of classrooms, so they would check the carbon dioxide level in the classroom in the morning before the students came in. And it was probably like 50, 60, 70, which is normal for a school building. They would go back in and measure it at 2 o'clock in the afternoon, and the carbon dioxide level was over 1,000 because the vents for circulation were blocked off. Okay, so it's frightening. And remember the school desks that we all used to sit in? Not the wooden ones, but like the plasticky ones that we used to sit in? They emit formaldehyde fumes. So if we all sat in those plastic desks in school, college, whatever, we were all exposed to formaldehyde. Not that I want to scare you. Is there an asthma coalition in your state or your city? You can refer families to them. You can refer schools to them. They'll come out and do education at the school with the teachers, with the nurses. And is there a state plan for asthma for schools in your state? There are a lot of states that do have really good asthma management programs for their schools. In that state, California is one of them that I remember looking up. Nebraska, this was a while ago, but had excellent. Virginia is also another one, had excellent asthma management programs for the schools. The state of New Jersey requires asthma education for every teacher every year, mandatory, so they know what to do. The next on the social determinants is social and community context. So what we need to look at is social cohesion. Are the communities working together? Is there civic participation? You'll probably see this more in the suburban than we will in the inner city. Are there perceptions of discrimination and equity? Are your child's parents or relatives incarcerated or institutionalized? You wouldn't think that that would play an issue, but it does. Does the family have social support? Is your parent of this child, are they all alone? Do they have anybody that they can talk to, rely on in case their child gets sick, that this person can watch that child so they can get to work? Is there family support? Or is there an extended family? An extended family could be neighbors, actual family, and community organizations. So after I've given you all this information, you're like, oh my God, what am I going to do with it? Because it's so much. And I know it's a lot. It takes a while. So we need to put the pieces together. And I think we can do it. So the important puzzle pieces are us as the healthcare providers. The family is another important puzzle piece. The school is a huge puzzle piece of children who are school-aged. The community that you live in or work in, we need to get them involved. Is there an asthma coalition, local or a statewide asthma coalition, that you can get involved, excuse me, to help you? And get the payers involved. They want nothing more than to decrease costs of caring for a child with asthma. I'm just going to get a drink. But payers are very willing to work with you now because they don't want to, don't want to pay as much as they do. So can we make these pieces fit together? And can we actually put the puzzle together to keep our children healthy? That's a big question. So as healthcare providers, we need to make sure we follow the guidelines. I know we have issues where I work in North Philadelphia, not my actual clinic, but community providers. We still have a community provider who I have seen prescribe liquid albuterol. That went away about 25 years ago, but it's still there. There are still people doing that. We need to educate ourselves about what's available for our kids and families with asthma. I mean, there's so much out there for all these other different disease processes. Asthma has always been sort of like, pushed under the rug or whatever. But people are starting to finally realize that, hey, this problem is not going away and we really need to work on it. Educate your patients and their families. It doesn't have to be, an hour-long program. Every time they come to see you in the office, 5 minutes, 10 minutes. Do you have any questions? Do you remember about this? Do you remember how to use your spacer correctly? Do you remember what triggers your child's asthma? And we found where I work, you can't ask a parent what triggers your child's asthma because they don't know. So I can ask what makes your child's asthma act up. And sometimes they know, sometimes they don't. So I'll usually have to prompt them through. But we started handing out a sheet for them to fill before I go in to do the visit of pictures of what can trigger their child's asthma. And boy, they see those pictures and they're bing, 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 bing. They know them if they have the pictures. But so make sure when you talk with your parent, you use words that they understand. Again, like I said before, refer to asthma home visiting programs. They are out there. It's just a matter of trying to find out. And thank God for the internet because that's where we can really find those programs. Again, work with your family, see what's needed. Do they need social services support? Do they need community support? Do they need financial assistance? Our big issue right now is that it's not really a healthcare provider issue, but it is so many of our families rent and are living in homes with carpeting. And guess what they don't have? They don't have vacuum cleaners. So how do they clean their rugs? They sweep them. So what happens when you sweep a carpet? You're sweeping all the dust and everything else into the air. So then the child comes home from school and is breathing all this in the air. So that's our next problem, is trying to find funding for vacuum cleaners to give to our families. And we're not talking $100 vacuum cleaners. I'll give them a $50 vacuum cleaner. That's fine. That's all they need. Just something that they can suck up that stuff off the rug. Make sure your families are an active part of the asthma action plan. If you have a child who is like, oh, I don't want to take my medicine, I forget, I don't like it, I don't want to use a spacer, you have to work with them. You can't say, hey, look, you got to do it twice a day, that's it, no ifs, ands, or buts. I found that You make a child show you that, yeah, they can take their medicine every day for a month. I tell them they have to do it for a month. And then at the end of that month, I will take them down to once a day. I'll increase the dose of their controller. They take it once a day, whether it works best in the morning or it works best in the evening, and it works. We had a mother who was living in a not very good living situation and ended up in a shelter. She was busy because I think she was working, didn't have time to make sure her child had his medicine in the morning because they were busy running out the door to school, put him on once-a-day medication. Now, unfortunately, they're living in a shelter, but he's taking his medication once a day, he's compliant with it, and he's not had any emergency room visits or hospitalizations. So sometimes we have to think outside the box. We have to work with what's going on in that family at the time. Yeah, it would be ideal if we could get everybody to take their medicine 2 puffs twice a day, every day, along with everything else. But if you can manage it that you can get all their medicine 1 time a day, or at a time that works for them, it works. So what do we do with the family? We have to listen to them. We have to listen with open ears. Don't go in with any judgments. These families are going through a lot. They want to work. They want to provide for their family. But sometimes it's just out of their hands. We need to educate at every visit. As simple as it be, do you remember their triggers? How's it working out with, showering after they come inside and play? Are you making sure they use their albuterol before sports? These kids want to play sports. A lot of my kids box, and it's working. They're doing really well because the more they get out there and play, the more they exercise, the more they're going to, be compliant with taking their medications. We need to be supportive of them. Sometimes they just need a shoulder to cry on, not that they're really going to cry, but they just need to know that you're there, you're available. Can I call you, if Johnny's having a problem at home? Refer as needed. If their asthma is not well controlled despite what you do, refer to the pulmonologist or allergist. Refer to community health agencies. If you live in a city and there's programs to help with repairs in a privately owned home, refer. Refer to a community lawyer if there's issues with landlords. Okay, that's all out there. And we have to do multifaceted interventions to help care for these kids with asthma. For school, we need to have an open communication. Okay, we need to be in communication with that nurse. We've had issues, I've had a couple of issues with kids of mine who, right at this point, I still don't have an open communication with them, but I had one girl who had asthma. Mom forgot to get her asthma meds filled, so she didn't have her albuterol before gym class. They had to run 4 laps around the gym. After the 3rd lap, she was having a hard time breathing. She told her gym teacher, I have asthma, I'm having a very hard time breathing. And he said, you don't have asthma, and made her run. She got mouthy, he got mouthy, and she got a detention because she had asthma. And then I had another nurse not believe that I sent the school form in to school. Make sure your school has an asthma management program. That's so, so important. Is the school nurse available every day? If the school nurse isn't available every day, is there somebody designated to give the medication when the school nurse isn't there? Okay? And I'm not sure about the other states. In the state of Pennsylvania, children are allowed to carry their albuterol and spacer on their person as long as they have the permission of their parent, their healthcare provider, and the school nurse. If you have a child who's on the 4th floor, has an asthma attack, and their albuterol is all the way down on the 1st floor or in the basement, makes it a little bit difficult. Community. Look to the local health department. Do they have an asthma program? Look to the local hospitals. A lot of the local hospitals are starting to develop asthma programs for the families. Community groups. Rec centers, PAL, Boys and Girls Clubs may be able to set you up with certain things. Social support groups. Catholic charities. We have a foundation that we're able to contact if we need funding to help with utility bills, help buy a vacuum cleaner, that kind of thing. And faith-based organizations. Churches are always willing to help out too. And this can also be in terms of if you have a family with food insecurities. Asthma coalitions. They vary state to state, but I'm most states that I've been in do have asthma coalitions. They provide education and resources for the healthcare provider, for the family. They can put you in touch with home visiting programs, and they can also advocate. And you can become a member of that asthma coalition and help advocate for your families. And the payers, Medicaid, private commercial insurance, they, like I said before, they want to decrease the cost of asthma. They're tired of putting out $56 billion a year. They want to keep these kids healthy too, just like us. And then they also have an availability of resources and sometimes funding, whether you're going for some grant funding to help do asthma, get things for your asthma patients. So this list, this is just a very small list of asthma programs throughout the country. You have Boston, a community asthma initiative in Boston that's been going since 2005. They go out and do home visits. They have programs for these kids. The Asthma Network of West Michigan has been doing home visits, and they were actually started by contacting a community or contacting a state payer. And they set up, and they're still going strong. Multnomah County, Oregon has a huge home visiting program. The New England Asthma Coalition, Breathe DC, again, environmental home environment, in Baltimore County, Maryland. This is just the tip of the iceberg of asthma programs that are out there. So there's a lot more. So just to give you a little idea of what we've been doing in Philadelphia, we have a Healthy Homes, Healthy Kids program that's run by the Philadelphia Department of Health. And we developed a partnership with them, I guess, almost 4 years ago now. Oops. And we worked together about 3 to 4 years. Families were referred to the program if the child met the criteria, if they had had 1 hospitalization or 2 ED visits within 6 months to a year, and if they were moderate to severe asthma and the family identified issues in the home that could be triggering their child's asthma. A community health worker with the city went out, did environmental assessment. They came up with an environmental plan for the home. They would send out contractors to do whatever work was needed. They also took in an integrated pest management. When they went to the house on the first visit, they would do a super clean on some of these homes, and remediation was done to the home within the scope of the program funding. It was about $3,000 a home. So, results of this program, they're limited because we had difficulty getting the data from the payers. But you can see it was pretty good. Data was collected 1 year prior to remediation and 1 year after remediation. Unfortunately, we only had data for 48 children. But the ER visits dropped by 32%. Hospitalizations dropped in this group of children by 89% in 1 year after remediation. Sick visits dropped by 52%. Cost savings per child was $2,300, and cost savings in total was just under $100,000, and this is only for 1 payer and with 48 kids because that's all the data they would give us. But we actually had another payer, but they wouldn't give us any data. So you can see that it really does work. And we had a pretty huge, I think we did about 150 homes over a period of about 2 years. So this probably would be double or triple of what it once was. So the next thing that we had to do, so we already have our home visiting program in place, was the school district of Philadelphia did not have an asthma management program or an asthma management plan. Their idea of asthma, they had almost like a flip book on cardstock with different emergencies. You know, if you've become unconscious, that was like number 1, bleeding, number 2, blah, 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 blah. Well, asthma was on about the 4th or 5th page after everything else, and just said give them albuterol. So there was no asthma management program in the city. So in the beginning, as I said, we had no asthma plan. Asthma was ranked very low in terms of emergency. It took the death of a child in a school that there was not a nurse there that day. The child had said she wasn't feeling good. They did not give her any medication. They sent her home after school. Her father got home from work, found her in severe respiratory distress, took her to the local children's emergency room, and she died within a couple of hours. So that's what started the whole asthma management process with the school district. A committee was convened. It was multidisciplinary. It was the State Asthma Coalition. It was St. Christopher's Hospital, Integrated Pest Management Program, school staff. I'm trying to think who else there was. I can't remember. But it took us about a year to write an asthma management plan for the school district to follow. Is it being followed totally the way we wanted it to? Not quite yet, but we were able to develop posters done by a former patient of what to do in an asthma emergency. We're still working on it. We put together an Asthma 101 for teachers. It's a webinar. They get 2 Act 48 credits. They can watch it at home on their computer. It's about a half hour, 45 minutes. Are they watching it yet? Not a lot, but we're hoping it will eventually get there. It takes a lot. So it's almost 2 years now, and we're still working on it. But with this going, things have gotten a little bit better, and the next step has been the classroom environment, and they are really, really working on that a lot, because there are a lot of issues in the classrooms. I can ask my kids when they come in to see me, do you see mice in your classroom? Yeah. Do you see bugs? Oh yeah, the big black ones? I said, yeah. So there's issues, and they see the dust and everything, and they had I forget how many schools we have, but they had like 1,400 exterior doors that had broken door sweeps. So the mice were coming in under the doors into the building. So they've finally gotten that under control. So what are our next steps? We need to partner, schools, coalitions, public health department, your city, your hospital. You need to collaborate. I know this sounds like a lot, and we need to advocate for these kids. Has anybody ever heard of the asthma control program run by the CDC? This map shows you what states are getting funding from that. The funding was cut last year, but they were able to still get about 24 states covered with the funding. It's a 5-year funding situation. But most of the other states do have asthma coalitions, but just don't receive funding from the CDC. So the stuff is out there. People want to help these kids, but it's just making everybody aware. So, has anybody ever heard about this, the plan, the President's Task Force on Environmental Health Risks and Safety Risks to Children? Has anybody ever seen this before? One person, okay, yeah, or 2 people, yeah. This was put out in 2012, May of 2012, okay? I didn't know about it until about a year after it was put out. It came out with 4 strategies, and it tells all of the governmental offices that are working on this, and this is just for children with asthma. So they have 4 strategies in this program to reduce barriers to implementation of guidelines-based asthma management, to enhance capacity to deliver integrated, comprehensive asthma care to children and communities with racial and ethnic asthma disparities, improve capacity to identify the children most impacted by asthma disparities, and to accelerate efforts to identify and test interventions that may prevent the onset of asthma among ethnic and racial minority children. So it's a good framework, but if nobody knows about it, it means that not a lot has been done, because everything that's going on right now in our government. But it provides a framework that maximizes the use of our existing federal resources. So what I'm asking you to do is go out there, become political, go to the state. If any of you have not visited the Allergy and Asthma Network booth downstairs, please visit. They're an advocacy group. We have Asthma Day on Capitol Hill on May 12th. If any of you live near Washington, D.C., it's a great day. We actually go. They have meetings set up with your congressmen and your senators, and their staff. You go and you meet with them, you talk with them about asthma, and these people really do care. Believe it or not, they do. The National Governors Association came out with a paper in April 2015 that health investments that pay off, strategies for addressing asthma in children. So even now the governors, the state governors, are starting to look at asthma. Now, this is brand new. I just happened to find this by accident when I was looking stuff up. But now the governors are getting it. So we've got federal involved, we got state involved, now we've got to get the cities going. And I'm not sure if you're aware of this, but back in January of 2014, CMS, which oversees Medicare and Medicaid, had revised some of their guidelines, and they revised their definition of preventive services, that home visits could be done by non-licensed personnel. And that was supposed to have taken effect in July of 2014. Unfortunately, they left it up to the states to make the decision on who was going to be allowed to do it. In Pennsylvania, we still don't have any kind of ruling on this yet, but that opens up the door to community health workers being paid by insurance, being paid by the hospitals to go out to the homes to visit these families. But, look into your states and see if have they started working on this yet. Because the government said, hey, we can have non-licensed personnel go out and do. Community health workers, the goal of a community health worker is to go out, work with that family, and help them improve their health and help them improve their lives. And when they're looking for a community health worker, they want somebody from that neighborhood. They don't want somebody who's educated and, especially in the urban cities, they don't want somebody from the suburbs coming in or whatever. They want somebody from the neighborhood, somebody bilingual, depending whatever neighborhood you're going to, Spanish or Russian or, Cambodian, whatever. But it's there. It's just we have to pick up the pieces and get going. And really exciting news, you probably haven't heard about this either, but back in December, there was a bill passed for Every Student Succeeds Act, which was passed. And Senator Gillibrand from New York had also put in this bill a School Asthma Management Plan Act, and that was passed also. So for those of you who have issues with your schools, and it's actually available to most school districts and to all states, as for fiscal year 17, there will be $1.65 billion available for states and for school districts to apply for funding for student support and academic enrichment grants to provide nursing, to provide medications, to provide education in the schools, and whatever else they feel is needed. So that's a huge step forward. And then I just found out just at the beginning of this month, 2 more representatives introduced to the House another bill of a school-based asthma management program, sort of similar, but it's just got introduced, so there's not much going on there. Yeah, okay. So, what are we going to do? We have the support that's out there. We have federal support, we have state support, we need to work on city support. We need to work together. You need to work with your, what's available in your community. It may take a little bit of work, it may take a few phone calls, it may take calling the EPA, but they're all behind us. We need to develop partnerships. It's really not that hard because people out there, they really want to help. They really, really do. It's just a matter of trying to find the time to get together, to meet together, lay down what needs to be done in your community, your neighborhood. It's not going to be easy. It took us a year to do a school management plan program. And funding is hard to come by. There is funding out there, but finding it is difficult, and then just trying to go through what they make you go through is hard. But we can do it. I don't want you guys to be afraid, okay? I know it sounds sort of daunting and overwhelming, but all of these programs that I had listed earlier, Boston, Multnomah County, Michigan, New England, Washington, D.C., Baltimore, they've all seen positive results, okay? So it can be done, and don't be afraid. That's what I've learned too, who thought I'd be on Capitol Hill running around? But you can. But so, again, like I said, if you want to go downstairs, Allergy and Asthma Network, it's a great advocacy group. Asthma Day on Capitol Hill is May 12th, and it's an awesome thing to do. And to end, it takes a village to care for a child with asthma. We can see the kids in the office, but it's not just what happens it's not just what happens in that office. Like I said, medications are a part of it, but we've got a whole lot more to look at. We can give them as much medication as we want, but if they're allergic to whatever's in the classroom or something's triggering them here or somebody's smoking in grandmom's house or they're in bed or they're going to smoke in their bedroom, it's not going to help. And thank you for listening. Does anybody have any questions? No? Did I overwhelm all of you? Frighten you? And then one thing I forgot to put down on your reference list is, I don't know if you've ever heard of the asthmacommunitynetwork.org. It's a great resource for programs. It's worked out by the EPA. It's part of the EPA, but they have their own separate website. So it's got programs. You can contact people if you have questions. It helps you to see what's in your area. Okay, so it's asthmacommunitynetwork.org. No questions? Okay, thank you for listening. And I hope I didn't overwhelm you.